Hello, good morning everyone. My name is Cantika Dewi with my last three-digit number is 029. I'm from class B and in this great opportunity, I'm going to do a presentation about diabetes. So let's talk about diabetes. Diabetes is a worldwide epidemic, as we know. With changing lifestyle and increasing obesity, the prevalence of diabetes mellitus has increased worldwide. Diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia. It may be due to impaired insulin secretion, resistant to peripheral action of insulin, or both. And according to International Diabetes Federation, approximately 415 million adults between the age of 20 to 79 years had diabetes mellitus in 2015. Diabetes mellitus is broadly classified into three types by etiology and clinical presentation. There are type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus. Let's talk about type 1 diabetes mellitus. Type 1 diabetes mellitus is characterized by autoimmune destruction of insulin-producing beta cell in the islet of the pancreas. As a result, there is an absolute deficiency of insulin. The next one is type 2 diabetes mellitus. Type 2 diabetes mellitus is defined as insulin resistant. During this stage, insulin is ineffective and is initially countered by an increase in insulin production to maintain glucose homeostasis. But over time, insulin production decreased, resulting in type 2 diabetes mellitus. Let's talk about gestational diabetes mellitus now. Hyperglycemia, which is first detected during pregnancy, is classified as gestational diabetes mellitus, also known as hyperglycemia in pregnancy. Although it can occur anytime during pregnancy, gestational diabetes mellitus generally affects pregnant women during the second and third trimesters of pregnancy. Patients with diabetes mellitus most commonly present with increased thirst, increased urination, lack of energy and fatigue, also delayed wound healing. Okay, so now let's talk about the treatment for diabetes mellitus. The treatment for diabetes mellitus, the cornerstone of therapy is diet and exercise. A diet low in saturated fat, refined carbohydrates, high fructose corn syrup, and high in fiber and monounsaturated fats need to be encouraged. Aerobic exercise for duration of 90 to 150 minutes per week is also beneficial for the treatment of diabetes mellitus. If adequate glycemia cannot be achieved, metformin is the first-line therapy to be given for diabetes mellitus. Also, for patients with type 1 diabetes mellitus, a regimen of basal bolus insulin is the maintenance of therapy. Also, insulin pump therapy is a reasonable choice. Now, let's talk about the education and prevention of diabetes mellitus. In controlling blood glucose level, patients need to be educated about the importance of blood glucose management to avoid complications associated with diabetes mellitus. Also, patients and people should be educated about stress management and including diet control and physical exercise. And then self-monitoring of blood glucose is an important means for patients to take responsibility for their diabetes management. Okay, that's all that I could explain about diabetes mellitus. Thank you so much for the opportunity.